Oh, it's gone. You see the slides, yeah?
Yes.
Happened the same thing, Dr. WALID. I'm sorry, يعني, but the impact of war on suicide and mental health, it doesn't move. Yeah, I'm sorry. Where is gone? Where I need to go, doctor?
Just choose the mouse or the arrows to move it.
يعني كان في it doesn't come. So sorry. Yeah. Yeah. Definitely, the suicide is the act of intentionally causing one's own death. Legalizing the suicide has been a real trouble in UK. Recently, in the House of Commons, they are discussing about assisted suicide. There are around 700,000, according to the WHO, findings of suicide around the world. It's illegal in UK to encourage or assist anybody in suicide. And assisted suicide, intentionally helping another person to end their life. And the physicians supply the lethal drug. Sometimes can the patient administer themselves. This is the assisted suicide. It's illegal and can face serious imprisonment. However, as you know, in other European countries, like in Switzerland and Holland, there are specific clinics who are really involved in euthanasia, assisted suicide. Here in the UK, they are discussing in the House of Commons about approving the bill for the assisted suicide. Definitely, the majority of the doctors in UK, they are against this bill because they need 2 doctors to complete the application for any individual who have specific kind of findings to consider assisted suicide. We know about Emil Durkheim, and in the 19th century, he was talking about suicide. And it's very interesting, actually, to understand and to read the book of Durkheim, to apply the findings into our clinical work. Durkheim, he worked in situations where the country in France and Holland, there was a lot of transformation from the agricultural community into the capitalist community. And he studied the sociology based on the transformation of the people, really, in terms of financial situations. And he divided the suicide into 4 types. The first one, the egoistic. when the people, they feel they are not belonging to the community or to the society. And usually they are in retired age or elderly. There is no more benefit of them. And so they feel it's the time to end their life. The altruistic, definitely this is an area which is very interesting to us really regarding in terms of war, where people sacrifice themselves for the benefit of the community or the cause. The anomic kind of type of suicide, when there is the society in itself, it doesn't fit. There is a disconnection between the individual and the society, and they feel that it's better to end their life. The fatalistic kind of type of suicide, where the people, they feel helpless really in their quality of life. And this is where suicide becoming a lead for to end their life. Usually you can find it in prisoners, and sometimes people who are severely depressed in helplessness and hopelessness status, they end up in this type of suicide. We have seen following the Second World War, a lot of soldiers being involved in the war, how they suffered from shell shock, combat stress reaction, nostalgia. They have been reported many research and studies regarding the suffering of the soldiers during and after the war. So the subjective feeling of imminent death during the war by the soldiers described as painful numbness. And as you know, that strategy, fight or flight response, described also symptomatology of severe trembling, dizziness, hyperventilation, stay alert, stay alive, exhausted children. They have been offered these kind of 48 or 36 hours where sodium amytal has been administered to them to sleep, to have good sleep, and also to have good meals and shower, and to clean themselves, to have a new uniform. And 70% following this intervention returned back to fight. Sodium amytal, it's a very interesting drug. I remember when I started psychiatry in the 80s, we used it a couple of times for abreaction. People who have traumatic experiences, especially in childhood, they are very good following 20 or half an hour sleep. They can bring up memories of these traumatic events. 40% of medical discharges during the war, in the field of the war, were of psychiatric conditions. And definitely after the war will end, these soldiers, they will end up in serious psychosocial problems like unemployment, homelessness. So it has been described since World War II, the post-traumatic stress disorder described with symptomatology of poor concentration, hypervigilance, paranoia, nightmare, flashbacks, anger, rage, depression, guilt, and active suicidal intent. So it's not a new subject to talk about PTSD within the war context. We know that during the wartime, the degree of
What is this?
The war, I think.
War?
We know during the war, the degree of social integration increases. and that leads to lower suicidal rate. And during the Second World War, you can see that in England, for example, before and during and after the war, before and after, it was similar in a way, but during the war, there is slight decrease of the suicide rate. And that also valid in Germany, in Japan a little, and in USA, again, little difference in USA. But in countries where not participated in the war, like Switzerland, you can see that the before 23 per 100,000, and during the war 19, and after increased. Yeah, so there is a decrease. And in Australia, the same slight decrease, but also after it decreased further. It's far away country from Europe in that particular time. Now the question is religion a protective factor against suicide? Definitely, we are fully aware of the suicide is prohibited in Islam. But there was a WHO study in 46 Muslim countries from 2000 to 2019. And the population of these countries estimated 1.39 billion Muslims worldwide. The majority of these countries, they are Muslims, but there are some other different religions. In the Muslim countries had the lowest suicide rate due to religious beliefs. And the police investigation usually in countries like that, they underreporting the suicide because of the psychosocial effect on the carers or families. In Jordan, for example, is the lowest country in terms of suicide comparing with the countries around Jordan. It's reported to be 1.6 per 100,000. I'm not sure, maybe Dr. Walid can help us. It's a small percentage. Some studies reported increased suicidal attempt among young students at high school and university. And we know people repeating suicidal attempts, they can be at significant risk of suicide. Suicide as guilt and manifestation of PTSD in Vietnam combat veterans. This is a study has been published in the American Journal of Psychiatry in 1991. The objective is to identify the factors predictive of suicide among Vietnam combat veterans with PTSD. They studied 187 veterans referred to military hospital. 100 confirmed the diagnosis of DSM-3 of PTSD. And out of these 100, 19 out of 100 had made suicidal attempts. 19. 25 over-preoccupied with suicidal thoughts. And 5 factors identify the risk factors to suicide. And that is guilt about the combat action, the guilt, unresolved guilt, survival guilt, the depression, anxiety, and PTSD. All these kind of elements can contribute as factors to suicide. Combat guilt was the most predictor of both suicide attempts and preoccupation with suicide. Within the PTSD symptomatology, definitely there is the anger and rage out of control were linked to disturbing images of killing women and children. So the women and children in the war definitely has a very strong impact on the soldiers later on in life. The conclusions that the Vietnam combat veterans with PTSD considered at risk of suicide. And the combat-related guilt was found to be the most significant risk of suicide. So people returning back from the war field with guilt feelings, they are at significant risk of suicide. Greater clinical attention to the role of guilt in the evaluation and treatment of suicidal veterans during the war. The PTSD and suicide, there are other studies which confirm the factors that they may have influenced suicide among the Vietnam veterans with PTSD. So longer period of exposure to combat. So when you study the cases, you will find that these people who have been exposed longer, they are suffering more, showing more negative paternal behavior. That also a factor contributing to suicide. Veterans who reported survival guilt. Those who committed morally wrong acts and that they condemned to live. So morally wrong acts, as you can expect, rape, for example, and they believe later on that they are condemned to live. Higher rates of substance abuse and history of accidental poisoning. Those who had been wounded during the combat, they are at risk of suicide. But let me just focus on a few things which I have seen. In my visit to West Bank, I have seen individuals who have more negative paternal behavior. When the soldiers, they come around the homes with the noise at the middle of the night, and they wake everybody up, and they arrest 12, 14 years boys. The boys, they would say, where is my dad? Dad is considered to be a protective factor for the children. So this can create the more negative paternal behavior, and that can lead into suicide. I don't know how many they have seen The Deer Hunter. It's a very interesting, actually, movie to watch, where they can, in the movie, you can see all these kind of elements, the factors contributing to suicide in the movie. And you can see also what we see now in Gaza about the people following the bombardments by Christopher Warren in the movie. Dr. Summerfield, he is well-known activist, and he made a lot of studies. And he says, war, it's not a private experience, so it will affect everyone. And is PTSD a normal reaction to abnormal situation? He says that since the Second World War, there have been around 160 wars and armed conflicts. Most of them, they are in civil wars, almost in the third world countries. At the present time, there are more than 40 conflicts going on in the world. Very often we don't hear about that, but that's reality. When we study the situation, we will find a lot of dynamics and factors, they are the same in each area. In Gulf War syndrome has been identified, and they described asthenia, fatigue, fatigability, anger, sleep disorder, the horror of the war history during the confrontation with death. I believe in Gaza we have a new nosographic entity during this war, which we never seen before. The killing of children and women, the destruction of the healthcare and the building caused mistrust with international law. We never seen this before. A lot of people talk about, well, the same happened in the Second World War with the Russians and the Germans, but definitely it's not the same. Here you have the bombs coming down from the sky and killing children and women living in the tents. This will complicate the whole adjustment following the war and how they react, these survivors, they will react to this situation. The airstrikes puts people under constant state of alertness where they have to fight or to freeze into death, really. The buzzing sound of the drones, they have been described as a horrible kind of experience. The chronic situation led to shortness of breath and neck and back pain. So there are some elements of when the war continues without stopping, or the fear of death takes people into this kind of situations as a chronic. The sleep deprivation also is a torture during the wartime. The analysis of scientific publications on the Gaza and Israeli conflict, this is in the Israeli magazine, medical journal, which they searched the database using the words Gaza, Hamas, Israel. And in other database, they used humans, violence, Israel, Gaza. And they limited the study between the 7th of October till the 23rd of November. The study, they looked at all the citations and publications during that period of time. They found that there are some publications neutral, and there are some pro-Gaza and pro-Israel. Definitely this bias thing is always there when you talk about the findings. They looked also at the country of origin from where this publications came, the journal name, and the number of times the following words mentioned in each publications, like Israel, Hamas, Palestine. They found 37 articles in 8 journals. 37 articles in 8 journals. 18 of them were published in the Lancet, which is a well-known medical journal, and 9 in the BMJ, 5 in the Nature, and 5 in other academic journals. And the country of origin, mainly in UK, but also Israel had published around 24%, Canada 5%, and Gaza 5% in that particular time, and Jordan 5%. 17 articles were correspondence, so they were responses to some article, 17. 12 were news about what is happening in that particular time, and 8 other types. Definitely, the results of that study confirm that the Israeli-Palestinian conflict is an emotionally charged issue. Always there is hatred there when you talk about what's happening. Academic journals covering this conflict with bias and may face charges. In fact, there are some academic settings have been brought to court because of that. Addressing bias in medical and academia when you talk about Palestine and their rights. So 16 articles they found pro-Gaza, 16, and 8 from the UK, 2 from Gaza, and 2 from Jordan, and 1 from each country of these. While 13% they were neutral, 13 number, 35% were neutral, 8 were pro-Israel, 8. 7 were authored by Israeli and 1 by UK. The 12, they were general news publications, and 7, they were pro-Gaza, and 5 were neutral. So according to this study by Israel itself, by Israeli authors, they have found that the majority of the publications on academic journal like The Lancet were of pro-Palestinian. Again, PTSD, depression, and anxiety after October the 7th attack in Israel. This is a nationwide prospective study by these authors and published on The Lancet online on the 5th of January 2024. It's a prospective study on mental health consequences following the attack on Israel. The findings confirm the prevalence of PTSD almost doubled cases between pre and after post-attack, with increased incidence of depression and generalized anxiety disorder. The study confirmed the urgent need for acute services, urgent intervention, or first aid psychological intervention. The methodology is simple and clear. There is a representative sample of the local population, and that will include males and females, Jews and Arabs. The study completed based on 2 time points before and after the 7th of October. The participants definitely, they consider that they have exposed into the attack, or individuals recruited online who have witnessed the incidents of someone killed or a friend or a relative being killed. The study used PTSD in intentional trauma questionnaire. And based on that, 18 items of this questionnaire measured the PTSD and the complex PTSD. For depression, they used the patient health questionnaire, and for anxiety, generalized anxiety disorder. For social-demographic and trauma-related characteristics, they identify the exposure into trauma, a family member or a friend, who also has been displaced from their accommodation to other, and they are referring to the around Gaza area and also in the north of the country. The paper recognized that human-made disasters cause significant and detrimental effect in terms of psychiatric comorbidity, like PTSD, depression, and anxiety, and hopelessness in exposed individuals which can lead into suicide. The introduction identified that the attack on the 7th of October, killing 1,200 civilians and kidnapping 240. And the prevalence and the severity were estimated by calculating the means of the war, related traumatic events, witnessing someone being killed or seriously injured, losing a loved one, witnessing a dead body, being a civilian in an area of war or terror. Now, when we talk about PTSD, definitely there are not all the individuals suffering of this condition, they are the same. There are complex kind of situation, and this is what we see in the current war. The complex emergency is defined as situations in which there is extensive violence and losses, massive losses, and displacement of people, widespread damage to essential public services. The large scale of humanitarian assistance has been disrupted, and obstructions to such assistance by political and social aspects of constraint, including security risks for the relief workers themselves. And this is what's happening in Gaza at the moment. Individuals with long-term mental disorder, what happened to them when this war started? They need special kind of attention. This never been studied or considered. The absence of appropriate care and lack of medication forced to restrain their ill relatives. These people, like schizophrenic patients or people with, people with learning disabilities, which resulted in further deterioration and put them at risk to be killed by the army. And this is what happened in Gaza. We have seen it. Anxiety sensitivity arguments augments the effect of repeated trauma exposure, the anxiety itself. People become vulnerable to further fear of suicide and increased suicidal risk. Addressing the global mental health needs requires the appropriate training and supervision where it was lacking. The NGO, the non-government organization, you can't really depend on them and we have witnessed when the war started in Gaza, most of them, they left the place. Now the situation is becoming more severe. The effect of weaponized social trauma. The enemy is trying to consider that every individual in Gaza is responsible for what have happened. And they are part of the terrorist in a way. And this is why they are implementing this kind of strategy, starvation. People who are witnessing the horror of babies and children dying of malnutrition. And this is a deliberate strategy to break the spirit of the population everywhere. It's not only in Gaza. It affected people everywhere. Youth individuals developed complicated relationship with food, meat, and national identity in response to the horror they witnessed. I have seen some patients in here who they can't really, young people, they can't eat meat now following what they have seen. We have seen the governments of Colombia, Sweden, and UN Secretary General calling for a first global ministerial conference on ending the violence against the people everywhere in the world. The true scale of the war is essential because this will help in the losses and the legal aspects of the war, as we have seen by the ICC, and also analyzing the post-war restoring the infrastructure. Now the suicide, with all this kind of dilemma, where we are from it, I think suicide requires capability, and there are multifactorial. So the war in itself, it doesn't really drive people into suicide. In fact, during the war, suicide rate is lower. The capability for suicide can increase over time, placing an individual at greater risk of suicide should desire for the suicide arise when it's arise. One way in which capability of suicide may increase through repeated experiences with painful and provocative events. If the provocative events increases, but we see that in Lebanon or in Gaza at the moment, they are continuous, such a trauma. Research among combat veterans from the Vietnam and Iraq showed increased capability for suicide risk for dying by suicide, and that's after the war. The factors can influence suicide among the combat troops, longer period of exposure, as we have seen in Vietnam, with history of injuries, more negative paternal behavior. Fathers, they were not there for their families and children, and survivor guilt. And there is a study, it noted that Vietnam veterans often report that they committed morally wrong, they are at significant risk of suicide. They suffer from higher rates of substance abuse, and this is what we have seen in Vietnam. This study is from Lebanon, and this is called Mental Health in Lebanon, Tomorrow's Silent Epidemic. And this is by colleagues, a group of researchers, mainly by Natalie Farhan, and described the 4th of August 2020 Beirut blast, where have exposed a lot of people into severe trauma, powerful explosions. They talk about at least 200 people killed, injured more than 30,000, and being homeless, and children 8,000. The pressure of the system on the system in Lebanon, as we know, it was huge, mainly because of the situation in Syria and refugees and the infrastructure of the country. It should be noted that recent systematic review showed extremely poor mental health among refugees in Lebanon, poor infrastructure, insufficient public and mental health services. There have been decades of war, civil war, and Israel repeated attacks on Lebanon, and that increased poor psychosocial circumstances, including unemployment. A question with no straightforward answer appears that what are the mental health consequences of these tragedies on Lebanese and for their future? The psychological impact of each recent tragedy in Lebanon is extremely complex. Results from a study concluded that the combined presence of pandemic-related fears and the increased PTSD and the stress and the anxiety around makes impact on each hardship for the population in Lebanon. Suicide and mental health in Lebanon. As we know, there have been more than 16 years of civil war, multiple Israeli attacks, and the Syrian crisis and the refugees in Lebanon. In a nationwide study, showed that the lifetime prevalence of anxiety disorders was 25% around, and mood disorders around 13-12%, and the impulse control around 4%, and substance abuse 2.2%. One study in Lebanon showed the annual rate of suicide between 2008 and 2019, I think, between 1.87 and 2.4, which is low, honestly. People in Lebanon are experiencing ongoing traumatic stress disorder, ongoing. And again, in Lebanon, they described as what's happening in Gaza, the sleep deprivation and the terror of fear of dying, and the drones sounds, the buzzy drones sounds is horrible. The impact of betrayal, this is a study in Israel after the 7th of October. There were some theories around the betrayal within the leaders of the country. The authors have two hypotheses: that the experience of betrayal based on moral injury will predict probable diagnosis of PTSD, and the changes in PTSD and depression between the time 1 and time 2, and that means between pre-7th of October and post-7th of October, will be significantly higher for participants who experienced moral injury. The betrayal-based moral injury in which the individual feels betrayed by the leaders. And in this study, there were 710 Israeli adults, 362 females, around 51%, and the Jews were around 80%, and the Arabs around 20%. And the ages between 18 and 85, and the completed validated self-report questionnaire assessed the PTSD, depression, and betrayal. There is a questionnaire on betrayal, I think invented by the researchers. They found the experience of betrayal predicted diagnosis of PTSD and depression. The phenomena of losing trust in the leaders and their failure to meet basic expectations being given the label of betrayal based on moral injury. And that's after the October the 7th. The moral injury scale, 9 items, measured assessing the events of potential moral injury among the civilians. The study is the first to demonstrate the critical effect of betrayal on its association. During this unprecedented time, civilians were found reporting a high level of psychopathology of burden. One of the robust risk factors that was found to facilitate higher psychological burden among the civilians was experiencing the MI, moral injury. Politicians, national and army leaders should be responsible and transparent in these kind of their plans for after the attack. The betrayal-based moral injury can lead to serious mental effects, such as the shame, loneliness, and also mental health problems like PTSD, depression, and suicidal ideations. A recent study has shown betrayal to be a powerful predictor for PTSD and depression. I think there are two elements which we need to take in consideration in any assessment of PTSD. One is called the resilience and the vulnerability. And this is the definition of both. Resilience is the ability to maintain a state of normal equilibrium in the face of extreme unfavorable circumstances. So, mood, yeah. Vulnerability is the potential for loss when exposed to hazard or loss. And there are etiological factors contributing to these two, definitely. The genetics playing a major issue in that. Yeah. So there was a study on monozygotic and dizygotic comparing the both, and they found it's more common in 34% PTSD in monozygotic twin. The neurobiology. We know during any kind of fear or anxiety, there are neurotransmitters which is becoming the main issue in the response and the reaction. The epinephrine, the noradrenaline, the cortisol, the serotonin. Sorry. The brain structure also, the amygdala, the hippocampus, and the prefrontal cortex. I see plenty of patients, honestly, they tell me, I can't remember what have happened. People who had traumatic experiences in childhood or in recent kind of trauma. So there is, even when they have been admitted to acute psychiatric ward, following a disturbance of behavior or paranoia, they will say, well, I can't remember. And the fact is, we as clinicians, we think very often in terms of organicity, why they can't remember, is there any problem in their brain? But the fact is, it's true. There is a disturbance of the memory and the emotional events response in circumstances of trauma. The psychosocial factors, also Summerfield, he looked at that, and what predominate the use of terror, like what's happening in Gaza now, it's social disruption. Yeah. So they are trying to involve every single human being in Gaza as responsible. The mental disorder and PTSD in Syria, wartime. This is a study which published online by the Cambridge University in June 21 by a group of researchers. So the war in Syria, definitely, it's affected the whole country. We can see the devastating effect on the people there. Since 2011, over 80% under poverty line and millions displaced around, some of them around the country, some of them abroad. The study evaluated the PTSD and the psychiatric and the mental disorders caused by the war and the refugees. It's a cross-sectional study that includes people who lived in Syria in different cities. And it's online survey, which they gave them the questionnaires called Kessler 10 scale, which identify the suffering of anxiety and depression based on research, and also for post-traumatic stress symptomatology tool. The result, the study included 1,951 participants, of which 527 around 27%, were male, and the majority were females contributed to the study. The age between 19 and 25, young samples, 44% had likely severe mental disorder, 44%. And 27% had both likely severe mental disorder and full PTSD symptomatology. 36% or 37% had full PTSD symptomatology only. And around 11% had neither positive PTSD symptoms nor mental disorder on this scale. The half of the responders were internally displaced. So people moved from Damascus to Halab or here and there. And 27%, 28% were forced to change places of living 3 times or more during the war. I think this is an important factor which can be studied after when the war finished in Gaza. Around 87% of the responders believe that the war was the main reason for their mental distress. Taking time off work was also considered, and somatic symptomatology has been also assessed during this study. Moreover, the number of times changing places of living due to war, educational level, and also being distressed, they are permanent factors contributing to the BSD. Professor Appleby in Manchester, he studies all the suicide cases in UK. And every year he published a report about his findings. He usually himself involved in these findings, and he published them through webinars and workshops. And this is what he is really suggesting, 10 ways to improve safety. And this is from the time when we see the individual, assessing them until they are recovering from the illness. And you can see in patients, when they are coming, you need to look at their symptomatology and where they are going to sleep and what kind of safety measures they are there. Yeah, people can kill themselves in minutes, really. And follow up after discharge is very important. Yeah, in the first 2 weeks after the discharge. We have an increased number of suicides on railway stations in UK. So they have set specific kind of plans in every station where staff, they are trained to deal with the situation when they notice an individual with this tendency. 24 hours crisis teams are available. So all these kind of measures, they are there in UK. Recently, the Lancet counting the dead in Gaza, difficult, but it's essential. In this article, they report around 250,000 of individuals between identified death and some under the rebel, 30% unidentified. 50% of the buildings have been completely destroyed. I think it's more now. The whole health infrastructure has been destroyed. Severe shortage of water, as we know, and they are in Yemen. Indirect cause of death, It's not only about shooting or bombs, but also complications of the infectious diseases and the consequences of the war itself. Inability to flee anywhere because there is nowhere. And as we know, they are stopping the funding on UNRWA. War, peace, and suicide. There are marked increase of pressure from international opinion demanding ceasefire. We have seen that. Others producing videos directly from the areas of war, terrorizing, traumatizing, worrying, victimizing, as we have seen, sad and guilt feelings, fearfulness, anger, feelings of alienation. They will ask who killed their parents, the children, who are orphans now. Sisters and brothers, they are killed. What the whole world doing to stop this horrible war, genocide? They will demand justice at one stage and economic catastrophe after the war. And we started to hear how expensive is the food and what you can find to buy in Gaza. The psychological distress among students outside the place of war. And this is a study published in BMC Psychology by Hindawi and colleagues, researchers. And this is in Egypt and Jordan. During the initial months of war, I think the first 3 months, cross-sectional study involving students, young people, between December and January 2024. And they are looking at the brief symptom inventory scale, which is very easy to use mainly for adolescents. And they are trying to identify the anxiety, depression, and somatization, 3 areas of these young people in Egypt and Jordan. And they managed to recruit 1,509 students, 66% female, 72% Egyptians, 28 Jordanians, who had no Palestinian connection. So some of the students had a relative or a friend of Palestinian origin in the country. Only 18% affected by the war. Only 18% out of the 1,509. The predictors for the general distress: watching the social media or multiple times a day and having a Palestinian connection. And this is very interesting because since the war started, honestly, I had a number of friends in Italy, in Greece, Sweden, and they started texting me text of sympathy around what's happening. So having a Palestinian connection is a very important factor, I think. Egypt had a higher somatization score than in Jordan. And the sample in Jordan had higher depression scale, and no difference in general distress or anxiety. The somatization was higher in those who had a relationship with Palestinian students. They strongly recommended that academic settings establish and maintain dialogue with the students and to enhance mental health support to all the students. And this is school students. We have seen in the world how they responded in London here fortnightly. There is a national march for Palestine till now, since October 7th. Aaron Bushnell, an American soldier who put fire on himself as solidarity, and this act of genocide, it's not in his name. And as we can hear nowadays about the ICC arrest warrant by the leaders in Israel. Finally, I have seen this gentleman on a number of international TVs, Mus'ab Abu Toha ismo. And he is a poet. He was reciting in English. He's from Gaza, and his poem is Humanity Under the Rubble. He says that she slept on her bed, never woke up again. Her bed has become her grave. Tom, beneath the ceiling of her room, the ceiling a cenotaph. No name, no year of birth, no year of death, no epitaph. Only blood and smashed picture frame and ruin next to her. In Jabalia camp, a mother collects her daughter's flesh in a piggy bank, hoping to buy her a blot on a river in a faraway land. It stopped me on his terminology. If you look at the cenotaph is the empty top. It's a Greek word, kinos and tav. It's an empty tomb. And the epitaph, no epitaph, is the stone where you identify the... and the piggy bank, it's very interesting. I don't know if you have seen or you have read The Merchant of Venice, تاجر البندقية, Shylock. He can trade money with others, and if they are late in their payments, he can, this is according to Shakespeare, he can request a flesh from their meat. And this is what's happening in Gaza now. So it seems to me, he selected the word carefully. Thank you very much for listening to me.
شكرا جزيلا دكتور أمين على هذا التقديم الرائع، ويعني بالتأكيد الحديث في هذا وكمية الدراسات هائلة، لكن الرؤية التي تقدمها رؤية مفيدة لنا كعاملين في مجال الصحة النفسية. ويمكن يعني نبدأ بالدكتور إلي كرم، كونك يعني ذكرت بعض الأوراق، وهو أكثر من كتب عن الانتحار في العالم العربي. ماذا يرى في هذا الحديث؟ تفضل دكتور إلي. هل بينما يجهز دكتور نزار؟
اوكي. شكرا جزيلا دكتور وليد لإتاحة الفرصة. شكرا دكتور أمين للمحاضرة الجميلة الطويلة الواسعة، و of course highly informative. I just want to say that I saw the deer hunter 44 years ago in London. Now, I will go very quickly through some notes about suicide. I tried to do some search today because I saw the title of your lecture. Unfortunately, most of the literature nowadays is on suicide during war among veterans and among army and soldiers. Only a few information is about civilian victims, and suicide among civilian victims. And by the way, the Durkheim's theory doesn't work all the time, because during certain wars, even including Vietnam War, suicide increased rather than decreased. But this is what's there. The second thing is, you mentioned that substance abuse increases there will be substance abuse after the wars. In fact, some of the papers talk about increased suicide among cannabis users. That's to say, the substance abuse itself will lead to suicide among people, and this will lead to both self-injury and suicide, both of them. As far as the gender differences between army members, some studies talk about equal prevalence of suicide among both male and females, while other papers talk about more in females rather than in males. This is what I'm talking about, army people. As far as the prevention of suicide, and by the way, I'm not talking about Professor Appleby's paper, no, I'm talking about prevention of suicide during war times. Most of the studies does not give clear conclusions, but they all concentrate on two things. The first one is the stressing social integration, and secondly, early treatment of PTSD. Those two things, they have proven that they are protective against suicide during during conflict zones, in conflict zones. As far as the suicide among army members, and as you correctly mentioned, most of the studies are done on American soldiers who served either in Vietnam or in Iraq or in Afghanistan. They found that early days of conscription are the more risky. Secondly, the type of the recruitment. يعني احنا بالعراق عندنا خدمة الاحتياط كان عندنا العفو خدمة الاحتياط والخدمة الإلزامية. But of course there is خدمة التطوع. In those who they volunteer to be in the army, the risk of suicide is less than those who are taken as a reservist to the army, because they have already left the army for many years and they are taken back to the army. So some of them either they rebel or abscond from the army, while others, the risk of suicide is high. Also, the type of the assignment they are given to differs among the army members. Now, one point very important, you mentioned resilience. I think Dr. WALID remembers, I personally have a theory, and my theory is that when there is stress for a few years, then there is no stress for a few years also, then there is stress again. This is very good for resilience, and I'm sure when the conflict in Gaza or in Lebanon or in other places ends, then people will become resilient later on. It's true that mental health problems will increase, but many people will become resilient to future events in the future. This is different from continuous, that's to say, long duration of stress for a very long time. Also, is that some of the veterans, the risk of suicide increase when they are released from the army, when they go home. And of course, mental disorders increase also. And also, we have to know that some people, when they are in the army, they are forced to do certain things, as you mentioned, and they feel guilty about it. That might be one cause of suicide. But on the other hand, some people might have predisposition to mental disorders, or they are already suffering from mental disorders, and they either volunteer to the army or they are taken as conscription in the army. And of course, this stress will lead to relapses and increases the risk of problems to those people. One point to mention is spirituality. Spirituality, not only religion by itself, yani it's not only the Islamic religion, it is the spirituality itself that really is highly protective against suicide among army members. The last point I want to make, with permission of Professor Ali Karam, is that, and I'm sure Dr. Walid remembers that I participated with him in 2 or 3 sessions dealing with people, or let's say talking to people who are either counselors, psychologists, social workers, or volunteers who are dealing with the victims of the war in Lebanon, in South Lebanon. The problem with people in South Lebanon is not only the native people of Lebanon who are living in the south. There are some Syrian refugees who are refugees in South Lebanon. They escaped from the war in Syria, and now they became internally displaced people on top of their refugee status in the south. So there are 2 stresses on them. And the problem is, just like in Gaza, they don't know where to go, because if some of them, they go back to Syria, and I hope that Dr. Jalal Nofal accepts that from me. If they go back to Syria, some of them might face problems, like, for example, taken into the army, or they might be tried for certain acts and so on. So now they are in a catch-22. They don't know what to do and where to go. I'm aware that some churches and some NGOs are helping those who are now Marakiz al-Iwa in Beirut. These are the points that I wanted to participate, and thank you very much again for the beautiful lecture.
دكتور نزار. دكتور محمد أبو صالح. صوت من عندك دكتور خلال. دكتور محمد أبو صالح.
تحياتي دكتور وليد واخوان، وطبعا امين صديقنا العزيز. الحقيقه ما انا طبعا فاتني بدايه المحاضره اخ امين، وقعدت لك مسج لانه I had a long day and long clinic ف I was a bit late. انا طبعا اعلمني الاخ امين من فتره، من كم شهر، انه بذهنه انه يساوي محاضره بهذا العنوان عن تاثير الحروب على يعني خطر الانتحار وحالات الانتحار ووسائل الانقاذ. بعثت له مجموعه موارد موجوده طبعا كلها. مع الاسف ما بعرف اذا بلغتكم نسيها. I hope I'm not breaking any confidence امين. ما سمحتكم التيوتر ولا الجهه المعنيه في المستشفى بيشتغل معه يقدم هيك محاضره. يعني اعتبروها انه ممكن تصير حساسيات ومسائل من هالنوع، علما الموضوع عام، ما موضوع غزه، موضوع عام. يعني مثل ما استعرض امين، يعني الحروب كلها، ومنها طبعا يعني الشيء صار بسوريا، وطبعا حروب لبنان ومسائل. فما يعني محاضره شامله مستفيضه كامله تغطي الموضوع تغطيه كامله. يعني ما عندي اي تعليق معين على الموضوع، بس موضوع الجوانب الكالتشرال يعني الثقافيه، مثل ما قال دكتور امين انه الابحاث او السابق او الإيميولوجي of suicidal behavior in the East Mediterranean region is shown to be much lower than other regions in the world. Although one has to always say that the documentation of suicide is never as good as you have in Western Europe or North America. But still, in general, the trend is for much lower rates, and cultural factors are important, including religiosity and spirituality, and of course, being the majority of Arabs are Muslims, and in Islam, suicide, self-murder is prohibited, and that is an important factor. In fact, I just sent to the group today, because I was noting that this meeting was happening, a PhD done in, I think, one of the Dutch universities, very extensive, interesting PhD published.
Excellent.
Yeah, I think it goes into enormous depth into about religiosity and spirituality and how that impacts. And of course, I think, as you would expect, that religiosity is associated with lower risk, although not necessarily every case. It depends on context. But anyway, I think we have a huge challenge there, as we have in Gaza, and of course what's happening in Lebanon or Syria and elsewhere. Our region is ridden with conflicts, about Michael Marmot's review commission and about the state of health in the East Mediterranean and so forth. So huge problems, and they will emerge in time. During crises, things don't surface, but they will surface later, and the impact is enormous on the physical health of the population, including mental health, and of course suicide and many other common mental disorders. So thank you for a very comprehensive, informative talk, which give a lot of thought, and really we truly appreciate it. I don't have much more to say than that. Thank you.
شكرا جزيلا دكتور سداد. ما في صوت ما في صوت دكتور سداد، ما في صوت.
That's better.
دكتور جلال.
مساء الخير.
مساء النور.
أهلا، مساء النور.
هلا أنا يعني هيك شكرا جزيلا. يعني هي محاضرة شاملة فيها كثير من المراجع وفيها تغطية، وعلى الأقل فيها يعني هيك حكي بشكل واضح عن غزة، عن بدون لغة يعني أكاديمية بالمعنى الضيق للكلمة. كيف استهداف الناس، كيف تحميلهم مسؤولية، وكيف قتلهم على أساس إنه كلهم بيتحملوا مسؤولية، كلهم كأنهم هن حاضر الحمل. هلا الجانب الآخر اللي بدي أقول عنه عن سوريا، أنا مع كلام الدكتور نزار إنه فعلا هن يعني في أخطار شديدة تتعلق بالناس. ممكن يعتقلوا، ممكن ينقتلوا، ممكن يتعرضوا لأي شيء، وهذا بالحقيقة يعني بخلي نوعية التقييم مختلفة. بدي أعلق بس على الشيء اللي حكيته، الدراسة اللي ذكرتها عن سوريا من كامبريدج. بالحقيقة أنا يعني عندي هيك شك عميق، يعني أنا اطلعت على هاي الدراسة وعلى دراسات أخرى. الدراسات اللي أونلاين، يعني سواء كانت الطريقة تبعها هي يعني سنوبول سامبلينج أو كونفينينس سامبلينج بسوريا، يعني من دمشق لحلب للمناطق الأخرى، لما بتكون أونلاين بتصور إنه في شيء يعني خليني أقول بيطرح أسئلة استفهام كبيرة عليها. إنه الفكرة بأنه المقابلات التشخيصية المتعمقة قد تعطينا نتائج مختلفة، وهذا يعني شيء مهم. الشغلة الثانية إنه حتى الوسيلة المستخدمة ما فيها خليني أقول تكييف مع السياق السوري. يعني هل الناس فعلا هن أصلا هي العينة غير تمثيلية، يعني نسبة الرجال للنساء ما لها تمثيلية. يمكن لاحظت يعني ذكرت لنا هي مسألة إنه حوالي الضعف من النساء. الشغلة الثانية إنه هل هن بمخيمات ولا بمناطق حضرية بالمدن، كمان بيلعب دور. أصلا يعني في مصطلحات عن الضيق وعن يعني اعتبارات هيك إنه الانزعاج، المشاكل الواقعية الحقيقية واللي ليس بالضرورة، لأنه طالعا نسب عالية. يعني كأنه بدلنا على أنه الريزيلينس عند السوريين كثير منخفضة، بالوقت اللي يعني مثل ما حكى الدكتور نزار قد يعني تكون على مبدأ فكرة أنه الضربة اللي ما بتكسر الظهر بتقويه، قد تتحسن الريزيلينس أو تتغير بطريقة معينة. لكن سواء السيلف ريبورت ولا العينات اللي مأخوذة بطريقة الأونلاين، أنا يبدو لي يعني تحيزها وجودتها أقل، تحيزها ربما يكون عالي وجودتها ربما تكون أقل، وخاصة إذا كانت عم تطبق بدون تكييف مع الأعراض، ما عم تأخذ السياقات المختلفة للسوريين بين المناطق اللي فيها يعني اللي النازحين الديسبليست بيبل اللي انطرحوا بسوريا، سواء هم المقيمين منهم كيف النتيجة والنازحين منهم وين موجودين. فقد تكون هي يعني أعراض ذات علاقة بإدارة الحياة أكثر من أنه علاقة باضطراب ما بعد الصدمة. فيمكن بحاجة أنه نعيد النظر، ما نعتبر أنه هاي الدراسة أو يعني بعض الدراسات السورية، لأنه أحيانا وصلت للبي تي اس دي بعض الدراسات ل 61 66%. فهذا أمر بتصور يعني بيعطينا وكأنه في هيك في دمار للريزيلينس عندنا. ربما كل هذا الأمر لما يؤخذ بعين الاعتبار تصير النتائج مختلفة وتصير قيمتها أفضل. شكرا جزيلا للعرض الجميل.
تسلم.
أي تعليق من دكتور أمين؟
نعم دكتور وليد. First of all, I thank you all for your comments. دكتور أبو صالح، يعني علاقتنا قديمة وبالتالي لها ثمن كبير، والحقيقة احنا بنمر في ظروف صعبة جدا يعني. فكان عندي اشتياق كبير إني أقدم هذه المحاضرة للميديكال كوميتي في العمل يعني. بس زي ما تفضلت يعني، هو الحقيقة إنهم بيخوفونا يعني في حكاية الانتيسيميتيزم يعني، وبخوفونا بطريقة إنه خلص ما لك مجال آخر إنه تعمل أي شيء يعني. في نفس اليوم كان في تهديد للتراست إنه في 83 جونيور دكتورز بيجونا من اليونيفرسيتي للتراست. فكان التهديد انهم هذول يوقفوا اذا في انتي سيميتيزم في any kind of comment about Semitism. فكان الموضوع يعني انه الشيف اكزيكتيف بيقول لي انت حل الموضوع اللي بدك اياه سويه يعني، بس انا ما بقدر يعني اضمن لك انه واضمن للتراست انه تظل المواضيع ماشيه. هاي وحده يعني صعبه. انا بالنسبه لي يعني كنت بحاول إني أبين الموضوع زي ما تفضلت يعني بطريقة أكاديمية. البحوث هاي اللي جرت وآثار الحرب على الناس يعني، وكيف إحنا بنقدر نتعاون مشان نساعد أهلنا في غزة يعني. فهذا اللي صار. شكرا دكتور وليد.
شكرا جزيلا. يبدو الدكتور سداد ما عم بزبط معه الميكروفون.
ما انت تسمعني دكتور وليد؟
الآن سمعناه.
تمام.
أنت يبدو بإسبانيا الدنيا السيتنج كلها بتتغير.
كلها تتغير. اي شكرا جزيلا والله على هذه المحاضرة. يعني في الحقيقة ما فيها هو ذلك البعد السياسي اللي يمنع أنه مثل هذه المحاضرة يمكن أن تلقى في أي معهد أكاديمي. محاضرة شاملة وبالحقيقة يعني هي good review for research papers recent. Yes, the concept of PTSD, as we know, it's very, very fluid. And war, I mean, it has social dimension, psychodynamic, behavioral, and disease. Yes, we focus more on PTSD and suicide, but there is more to do, really, from politicians, from United Nations, from government, from people all around. وشكرا جزيلا على هذه المحاضرة الرائعة. بارك الله فيك.
تسلم.
شكرا دكتور أمين على هذه المحاضرة، وشكرا لكل الزملاء على الحضور والمشاركة. دمتم بخير وإلى اللقاء. تصبحون على خير.
صباح الخير.
طيب.